It's not zero, but it's extremely low.
They didn't think that this was the case, though, when they first started to lock down the country. Do you think that it's a situation where once they've proceeded in a certain way, it's very difficult to correct course?
It's almost like people really wanted a panic. They, so it's quite crazy.
But in some places, a panic is deserved, right? Like if you're in the ICU in Manhattan and people are dying left and right, and everyone's on intubators, and it seems like when you see all these people on ventilators and so many of them are dying, and you see these nurses are dying and doctors are getting sick, in some places that fear is justified. But then in other places, you're reading these stories about hospitals that are essentially half empty. They're having to furlough doctors and nurses because there's no work for them.
Most of the hospitals in the United States right now are half empty. In some cases, they're at 30% capacity.
And is this because they've decided to forego elective procedures and normal things that people would have to go to the hospital for?
Yes, I mean, and we're not talking about just some of these elective procedures are quite important.
Yes.
Like it's like you have a bad heart.
Gallbladder disease, yeah, sure.
Yeah, and you need a triple bypass. It's like sort of